3 months ago, I declared an end to COVID-19 as a global health emergency, although I said that it remains a global health threat. Since then, the number of reported cases, hospitalizations, and deaths globally has continued to decline. However, the number of countries reporting data to WHO has also declined significantly. In the past month, only 25% of countries and territories have reported COVID-19 deaths to WHO, and only 11% have reported hospitalizations and ICU admissions. There is no question that the risk of severe disease and death is vastly lower than it was a year ago, thanks to increasing population immunity from vaccination, infection, or both, and from early diagnosis with better clinical care. Despite these improvements, WHO continues to assess the risk of COVID-19 to global public as high. The virus continues to circulate in all countries, continues to kill, and it continues to change. WHO is currently tracking several variants, including EG.5, for which we are publishing a risk evaluation today. The risk remains of a more dangerous variant emerging that could cause a sudden increase in cases and deaths.
EG.5 is one of the sublineages of Omicron that is in circulation. It's a descendant lineage of XBB.1.9.2, and it has the same spike amino acid profile as XBB.1.5. In terms of its behavior, it has an increased growth rate, as we expect all of these sublineages that are emerging. We don't detect a change in severity of EG.5 compared to other sublineages of Omicron that have been in circulation since late 2021. To date, there have been about 7,000 sequences of this EG.5 sublineage that has been shared with public platforms like GISAID, and they've come from 51 countries. I think what is important is that today we will be classifying this as a variant of interest.
We recognize that many people and governments view COVID-19 as a thing of the past. So why are these recommendations still important? For those who lost someone they love, for those who continue to be at risk of severe disease or death, for those who continue to suffer from post-COVID-19 condition or long COVID, for them, COVID-19 is still a daily threat and a daily trauma. WHO will not forget about COVID-19, and nor can governments.
There is no currently predominant variant anywhere, but a number of co-circulating variants. Decisions on vaccine composition remains challenging. When we do the virus antigenic mapping, we look at all the viruses that are circulating and all the variants that are circulating, and we try to select the antigen that will provide this maximum breadth of immunity, so that the protection to people is as wide as possible, anticipating that the virus may evolve between the time where the recommendation is issued and the time when the vaccine is produced.
WHO remains highly concerned about the worsening humanitarian situation in Sudan, which is now entering its 4th month of conflict. More than 40% of the population of Sudan is now in hunger, double the number since May last year. Limited access to medicines, medical supplies, electricity, and water continue to pose a challenge to the delivery of healthcare in states affected by the conflict in Sudan. WHO is also concerned about the humanitarian situation caused by the recent conflict in the Amhara region of Ethiopia. almost 2 million people are in need of health assistance. The situation is made more complex by the influx of refugees from the conflict in Sudan. We have also built a cholera treatment center in Bahir Dar, but we face severe challenges with access and communications. The people of Amhara cannot bear another conflict. WHO calls on all parties to the conflict to cease hostilities and return to talks.
There's no high-tech solution for dengue. Dengue vaccines aren't available. We don't have a magic wand. But cleaning up breeding sites and using larvicide at breeding sites is highly effective. But that involves investing in communities. That involves dealing with peri-urban slums. That involves dealing with the people who are undocumented and unregistered in society. That means dealing with poverty. So there are solutions, but there is no high-tech solution around the corner for something like dengue. Dengue is a symptom of our society. It's a symptom of the way we make people live. It's a symptom of poverty, and it's a symptom of the lack of application of simple interventions that are easily affordable in the right place at the right time.